Good morning, all. Thank you so much for joining Advocates for Ohio's Future's budget webinar, talking about the executive budget part 2. We are almost 1 month through the budget process. The first month is knocked off the timeline. So thanks so much for being here while we dive into what is in the executive budget and what that means for the rest of budget advocacy. I want to start with a reminder of the budget timeline and where we are and where we're going. So, right now, the House of Representatives is in hearings and is in the middle of accepting public testimony on the budget. We're working towards the House Substitute Bill, which is the first edited version of the budget after the governor's executive budget proposals, the first opportunity for amendments. And we're charging toward that deadline, which is coming up on March 14th. So there are still some testimony opportunities. There was a lot of public testimony that was heard this week and last week. There is one final week of public testimony that will be heard in the standing committees that are issue-focused committees on the budget. This is what I am sure is not a comprehensive list of all of the testimony opportunities that are coming up next week. And then the budget will move back to the House Finance Committee the week of March 10th for additional public testimony opportunities and the deadline for amendments to be submitted and considered for the House substitute budget bill is Friday, March 14th. So, because I know that this is not a comprehensive list of testimony opportunities that are coming up next week, I do want to share again this slide that we shared 2 weeks ago about tracking all of the moving pieces and how you can stay up to date with the Blue Book, and all of the Legislative Service Commission Red Books are now out and published, as well as the comparison document, which is the document that will be useful in tracking how the budget changes throughout the process. It lists all of the provisions that are included in the budget, and you'll be able to track them as they change in each, the House sub bill, the House omnibus, House passed version, and so on. And you can also make a free My Ohio Legislature account that you can use to track the hearings. So if you are looking for an opportunity to testify on the budget on a certain issue area, you can check out these resources in order to make sure that you don't miss your chance, because the process is moving very quickly. And with that, I want to turn it over to the incredible advocates and panelists who are here with us today. We're starting off with Kate Rossman with the Ohio Children's Alliance to talk about what OCA is watching in the budget and what we all need to know. So take it away, Kate.
Thanks, Sarah. As Sarah said, my name is Kate Rossman. I'm the manager of policy at the Children's Alliance. And before we get into some of the budget items that we're watching, I wanted to spend just a couple minutes talking about who we are. The Children's Alliance has really grown and evolved over the last couple of years. So I thought maybe a quick refresher might help to provide some context. So who we are, we're a nonpartisan, nonprofit organization dedicated to supporting the needs of families, communities, and the providers who serve them. For over 50 years, we have been a change maker in the family and child services sector. We advance public policy, best practices, and collaborative strategies to produce better outcomes for a stronger Ohio. So, our membership, we have a continually growing network of over 90 agencies that provide a diverse portfolio of services in our communities, including foster care, adoption and kinship care, independent living and extended foster care, child and family behavioral health, and then there are some other services that our members provide as well. So education and school-based mental health, early childhood and child care. We also have a few specialized programs on food insecurity, housing and homelessness, human trafficking, victim services, etc. But we primarily focus on the child welfare and behavioral health spaces. Our foster care agencies play a critical role in supporting the child welfare system in Ohio. They recruit, train, and license foster families to ensure safe and stable placements, provide case management and ongoing support for foster parents and kids. They operate treatment foster care programs to youth for high behavioral health needs. They run residential treatment programs for kids requiring intensive care, and they deliver family support services to work toward reunification or permanency. So our system in Ohio is unique because we are a county-run child welfare system, which means all 88 counties do things differently, and not all 88 counties provide their own services. So while the counties have custody of kids in the foster care system, they're not all providing the direct services, and that's where our membership really comes in. And then we also, like I said, focus a lot on behavioral health. Our behavioral health providers provide community-based, home-based, and school-based behavioral health treatment for kids and families. They also provide day treatment programs, and many of them are involved with Ohio Rise. So several CMEs are Ohio Children's Alliance members. Our members provide respite through Ohio Rise, and we also have a few PRTFs operating also through Ohio Rise as well. And so in addition to our membership, we have many programs that we operate in partnership with state agencies and foundations. These include the Bridges program, foster home recruitment. We have a respite referral program. And then we also work with the Child and Family Behavioral Health COE. We also do a couple of programs that are higher education related. So Fostering Futures, Ohio Reach, and Bridges. All right, now I can get into our budget priorities. Like I said, I hope that that provides some context for who we are and sets kind of the stage for the things that we're watching in the budget. And so I'm going to go through this by talking about our budget priorities, but I'll give some context and background as to the issues as I go. So there are many investments that are in the as introduced version of House Bill 96 that we wholeheartedly support. So the sustaining of behavioral health Medicaid rates, we're very happy to see that. We're hoping to build on that investment, especially taking inflation into account. Um, we're also very happy to see some of the career pipeline and innovation funding offered through the Department of Behavioral Health introduced budget, as well as the DCY budget. We are also excited to see, but not super surprised to see, that Ohio is implementing its own CCBHC model, building on some of the work that the Department of Behavioral Health and the Department of Medicaid have done already with stakeholders across the state. So they'll be standing up an official CCBHC structure through this bill. We are also looking at student wellness and success funds, which has seen a little bit of a dip with the the education budget. We are hoping that funding for public schools remains steadfast and includes that important funding for student wellness and success programs, which aim to provide both physical and mental health services to kids in schools. And then finally, we are very excited to see that some of the GRF line items, like the state protection allocation, has seen an increase, which is really going to benefit the foster care system as a whole And then there's some specialized innovation funding in behavioral health as well. So in this budget, we have mostly maintained funding in the foster care and behavioral health spaces. There are a couple places where we've seen a little bit of a dip, like multi-system youth funding and then student wellness and success. But then we've also seen some new dedicated funds as well. There is a $10 million child welfare best practices line item. This has gone through in the last couple of budgets. And that funding is to help primarily with best practices in investigations and casework. And we're hoping that in this state budget process, that funding can also help with best practices in recruiting and retaining foster families and our child welfare workforce. There's also in the DCY proposed budget an effort to create rate cards for foster care. So this initiative would allow DCY to establish standardized. And as I mentioned before, we are a county-run system. So all 88 counties do things differently. They have their own individual contracts for kids in care. And so the funding for one child in one county in the foster care system is going to typically look different than a child in another county. And so this initiative would bring some standardization to those practices. We at the Children's Alliance absolutely support standardization across the counties. We certainly don't want to see disparities in the care that kids are getting, but we are proposing and hoping to look at establishing a work group to develop a statewide child welfare set of contracting recommendations. So to look at the issue more globally, talk about what the drivers are behind the increase in costs from some counties to others. Like I said, there are a lot of factors that go into the rates being different. So just looking at that from more of a holistic lens based on the true cost of care. Something that is not in the budget, but I know is being discussed, is the Foster to College Scholarship Program. So that was introduced in the last General Assembly by Dontavius Gerald in the House, and then Senator Reynolds in the Senate. And unfortunately, that bill did not go through. It did get a lot of support across the aisle and across both chambers. We've heard that that might be moving to be put in the budget bill, and we absolutely support that. More states than not have some sort of scholarship fund to support kids in foster care receiving higher education, and we absolutely need to be a part of that. So very much looking forward to future conversations about that. There is also, I just want to highlight, in both the Department of Behavioral Health and the Department of Children and Youth proposed budgets, some policy language that would allow both agencies to suspend licensure for foster homes as well as children's residential treatment facilities. So the language would give them expanded authority to shut down a foster home or residential treatment facility that they're looking into that might have done something to hurt a child. We absolutely support their expanded authority to be able to deal with bad actors. And we're definitely looking at this language because it is so broad. And we want to make sure that in this language, it does not capture good actors accidentally, because the ability for suspending a foster home or a residential treatment license would be based on a lot of different factors, and the language is pretty wide open. For example, if there's harm to a child or risk, or there could have been harm to a child. When we look at that language, we think to ourselves, what exactly does that mean? And where is the requirement for the providers in that scenario? So if a child gets hurt playing a sport, what do we do in that kind of scenario? Um, And I think that was all that I really wanted to highlight in this budget from the Children's Alliance. Like I said, our advocacy is to support providers, it's to support communities, and it's to support kids. So we think that overall this is a great budget for kids and families. There are definitely some areas that we're looking at. Like I said, that I think are good overall and well intentioned, but we want to make sure that that we get the language right and we focus on those holistic issues, kind of underlying some of the conversations that we're having now. But that's all I got.
Thank you so much, Kate. Yes, thank you for the overview of the complex provisions and language that we should keep an eye on. Next up, we'll hear from Lysette Arnold with the Public Children's Services Association of Ohio. So I'll turn it over to you, Lysette.
Okay, hi everyone. I'm Lysette Arnold. Lysette Arnold, the policy coordinator at Public Children's Services Association, PCSAO, that's how I refer to it. So we're a statewide membership organization that represents Ohio's public children's service agencies. And we provide training, technical assistance, resources to the agencies. And we also help navigate policy changes, best practices, and any emerging issue or challenges in child welfare. We try to stay on top of it to work with our members. Um, okay, I'm like not used to not doing my slides. Okay, so PCSEL has made the placement crisis our top priority. In this budget, Ohio's child welfare system is struggling to find safe, stable placements for children in need. So right now, there's a shortage of foster homes and treatment facilities, especially for children with complex needs. This forces many kids into placements far away from home, even out of state, disrupting their stability and family connections. And at the same time that we're experiencing the lack of placement options, the cost of care is skyrocketing, particularly for specialized treatment and congregate care. So counties are struggling to keep up, and it's putting an immense pressure on their budgets. So, and as we all know, with few placement options, that comes with children staying in offices, hotels, hospitals, environments that are not meant for children. It can be traumatic, leaves our caseworkers scrambling. And I do want to show a little bit of data. I'm not going to go too deep in the weeds, but first, if you look at this first chart, it shows on the left, you see that kids in custody have in paid placement have decreased since 2020. So you can see from 2020 to 2024. And you look over here on the right, placement costs have increased by 68% since 2020. You can go to the next slide. And there's a lot of reasons why the placement costs have skyrocketed. One of the reasons is the placement costs have increased across all settings and have outpaced inflation. I didn't add the other chart here, but it's important to note that counties pay nearly 3/4 of all placement costs, while federal reimbursement covers the remaining 1/4. So our counties are pretty much drowning trying to keep up with the rising costs. You can go to the next slide. So this is just like a little part of the one pagers and data that we've been sharing with people. So to address the placement crisis, there needs to be there has been some investment. Is some investment in the budget. So we hope to maintain the funding proposed. So two of our big buckets that we're looking at is the state child protection allocation. Kate already mentioned this. So this allocates this state share of funding to county PCSAs. And then we also are looking at children's wellness campuses which would provide short-term treatment and care for youth with multi-system needs. You can go to the next slide. So this slide, I'll just go over a few of the key important line items. I didn't include everything. There was child welfare is an enormous system. So we do have a lot of things that we're tracking, but I just pulled out some of the key things. So first, the multi-system youth fund, it remains at 25 million per year. A lot of this Kate already mentioned the best practice and incentives. So that will be 10 million annually. I've mentioned the state child protection allocation. We're very grateful for this increase. It will definitely help us to address the placement crisis. We're excited about this flexible funding here, activities associated with delivery of children's service activities. And then I won't go over everyone, but the last one I'll talk about is the child wellness campuses. So they're receiving 20 million in the first year and 10 million in the second. These one-time funds, they stem from a state working group recommendation that came out of the last budget, where a lot of agencies and partners came together to discuss solutions for the placement crisis. So this was one of the things that came out of there. So yeah, I didn't include everything. So if there is something that I didn't mention or you're curious about, please just send me an email and I can follow up with that line item in whatever context you might need. Okay, and then there's just a few other policy changes. Again, reach out to me if I didn't mention one. So we have the language giving DCY the ability to establish statewide rate cards for placement and care of children. Our understanding, our understanding is that this isn't setting rates, but creating something to make reasonable rates. So just kind of surveying and figuring out what is reasonable to charge for these placements. I'm not the one to talk with about this. So if you do have more questions on this, I'll definitely connect you with people who have more, who have a better understanding of how this process will go. And then we also have, I just put benefits use, but there's been a growing debate over the use of Social Security funds, well, benefits for children in foster care. So currently, many of our agencies use these funds to pay for the cost of care for eligible children. But there has been a lot of advocacy around making these benefits to be set aside for the child's future rather than using it for daily expenses. So part of the budget includes language to prohibit the use of Social Security benefits and not just Social Security, but they're here, the veterans, the public employee retirement system, the police and fire pension fund, any of those benefits you will not be able to use anymore. We're excited to work with others to make this to make sure that our counties are able to you know, move away from using those funds and looking forward to, you know, getting this money to the children. So yeah, more on that. Hopefully we'll be watching that and working with others. And then lastly, obviously, PCSEO, we understand the economic stability plays a major role in child welfare involvement. And we're closely monitoring like some key economic and concrete support measures in the state budget. So that includes childcare, which I know you'll hear a lot about later, early childhood grant program, the child tax credit, and the moving of the community action agencies to ODJFS. So while we're here, I do want to mention some of the things we would like to see in the budget. So our workforce continues to be a challenge, and without state level investment, we risk failing its most vulnerable children and families. So if there's an opportunity during this budget process to consider supporting 2 higher education programs, and that is the Ohio Fellowship Program, which targets students who are not social work majors. They're doing like similar majors, so like maybe like criminal justice, psychology, things like that. It targets those students to um, come and work at the agency. So that will place an additional 125 fellows. Um, and then our university partnership program, we hope to expand this across more universities and at more social work students at our agencies. That's it. And then here's just a little bit more data on our workforce. I know workforce is an issue across a lot of our uh, child serving systems, but it's very important in child welfare for a child to uh, maintain their original caseworker because it does affect their permanency. It does cost a lot to replace a caseworker, but we understand that this is high pressure work. Um, it's not for everyone, so we do want to target those who would be a good fit to care for children. And I think that's it. Yeah, that's it. Again, contact me. Let me know if I missed anything, and if I can give you some more context.
Thank you so much. Yes, it's definitely hard to talk about everything in the budget relating to child welfare in just 8 minutes. Thanks, Lysette. And if you have any questions, start popping them into the Q&A function, and we will answer those at the end of the webinar. And let's continue talking about kids in the budget. Let's go to Brittany Boulton with Groundwork Ohio to talk about what you're watching, Brittany.
Thanks so much, Sarah. Thanks for inviting us here today and appreciate presenting alongside our friends Lysette and Kate and Gina. Really great lineup today. I'll just share briefly about Groundwork Ohio. For those of you who don't know us, we're in our 20th year. We're a statewide, nonpartisan, nonprofit organization focused on advocacy and movement building related uniquely to children from birth to age 5. We also do advocacy work around moms and folks who are pregnant and prenatal health as well. A brief overview of our policy agenda, I can go ahead and just share that we are not currently seeking any amendments to the governor's version of the budget as it sits in House and House Bill 96. There are a lot of historic landmark investments for young children that fall under our wheelhouse kind of across these 3 policy areas. So making work pay for working families who have young children, improving health outcomes for moms and babies, and then supporting quality early learning experiences. So I'll talk about each of these one at a time. Making work pay for working families. So we know that families have been having to cut back their work hours to care for their children. We have done polling research on this as recently as December and found that over 1 million of Ohio's working parents have cut back hours due to childcare barriers. So we were thrilled that the governor's budget increased access to publicly funded childcare subsidy. We're currently at 145% of federal poverty level in order to access those benefits, which is the most restrictive in the entire country and DC. So 51st out of all 51. And we are seeing an increase up to 160%. So folks earning a little bit more. And that would be in the statute change. But then there is the child care voucher program that the governor introduced last year during his state of the state to cover that gap between 160% and 200%. The reason that that is structured differently is because there is concern among the legislature that, well, I don't know, the governor might have had different reasons, but the way that we've been seeing it explained to the legislature by the Department of Children and Youth is that the 160 to 200% being a voucher program could be turned off next General Assembly if the future legislators beyond this GA decide that they don't want to invest in this programming. So we wouldn't be tying the state's hands to fund something that they don't have the funds for down the road. Additionally, we are very excited about the proposal of a child tax credit of up to $1,000 per child per working family. There are some charts that you can see related to the spending levels, or I'm sorry, the income levels. If you are making $94,000 or below and married filing jointly, you can have access to these funds. For single parents, that number is $69,000. And this is a refundable tax credit. So while we know that cost of housing, cost of food, cost of everything, and inflation are just completely detrimental to parents and children's wellness and outcomes right now, this puts money back into the pockets of families to do whatever they need with it. They can put it toward childcare or basic needs. And we've got some friends that have done some really great analysis about what those dollars could cover based on different income levels for different family sizes. So I'll put a link in the chat here and when I'm done presenting from Scioto analysis that shows how for some families this could amount to 2 months of groceries or 2 grocery trips, which is really a game changer right now for families who are living on the brink. And we know that there's bipartisan support for this. In that same poll that we did of over 800 families and Ohio voters in December, 84% across party lines, this is Republicans and Democrats, support a child tax credit. So there's tons of support for it across the aisle. And I think that we have an opportunity here to make a tangible difference in the paychecks or in the household budgets of Ohio families. Next, I'll talk a little bit about some of the investments that are specific to moms and babies. So home visiting is a really critical service for helping connect moms to services, both prenatal and postnatal. And so last year, the governor had introduced the Family Connects model, which does not have any income requirements. This is a universal model that all families can have access to. It's in 11 counties right now. The current budget would expand it to all 88 counties. There are also additional supports for Help Me Grow and some other home visiting programming. Altogether, we would see an increase in coverage from the current 10,000 families to 35,000. So an additional 25,000 families would be covered by home visiting programs that provide critical prenatal education, newborn care, and parenting support programming, and really help refer families to necessary services during that really vulnerable period of their life. So really thrilled about this. And this is more state dollars, whereas the child care benefits that I mentioned earlier being expanded, those are primarily federal dollars, block grant, as well as TANF. And then the child tax credit currently is being proposed to be funded by cigarette and other tobacco product tax increases, which are under current debate in the Ways and Means Committee. Sorry to go backwards a little bit on you. So another note on the maternal and young child health outcomes. We are very supportive of the incredible work happening in Cincinnati. They're actually seeing improved outcomes for Black babies. And it was through this Cradle Cincinnati model, all sorts of wonderful partners on the ground in Cincinnati, like Queens Village, Mama Certified, and Cradle Cincinnati leading the charge to center community-based voices, to center Black moms' voices, birth workers' voices, and really bring together at the table hospitals, clinicians, managed care, patients, and all of the community partners it requires to tackle infant vitality and to make sure more babies are living to their first birthday. So this budget, as it currently stands, would invest in strengthening these programs and scaling this collaborative impact model beyond Cincinnati and trying to replicate this around the state. And it'll look different in each community based on those unique community needs, but that centering of community-based voices and lived experiences and on-the-ground expertise is absolutely critical to outcomes. This is roughly $32 million per each year, and it would also expand some faith-based support programming on the ground as well as some parenting and pregnancy programming. Finally, the last bit of slides here are around the early learning investments. So we have seen an investment to support our childcare workforce, the folks who are the childcare professionals taking care of our kids each day, educating them, helping them grow physically and emotionally and socially. So these investments would update our reimbursement rates for childcare that are currently at the 50th percent of the 2022 market rate. This is a little bit tricky because we're increasing it to the 50th percent, but of the 2024 market rate. So we have a lag based on what the market rate is. And we're also moving toward enrollment-based payment rather than attendance-based payment, which provides financial stability for providers. And on the family side of things, the budget would also, in order to meet federal requirements, cap family copays at 7% of household income, which is very exciting. In addition to those supports for early childhood educators, which we know will better equip them to support our young kiddos, there is also a provision to increase funding for the Dolly Parton Imagination Library by $2 million each fiscal year, totaling $10 million each fiscal year, and expand access to evidence-based curriculum like the science of reading. So those are wonderful outcomes that we would love to, or wonderful programs that help us reach great kindergarten readiness as well as third grade reading outcomes that we would like to see supported. And additionally, we were thrilled to see the inclusion of expanded funding for early intervention services. This is specifically the Part C. And this is not just evaluations and assessments, but what we're hearing from providers on the ground is that they need support for service coordination. There's a big gap in service coordination for families with kiddos who have these potential developmental delays. So we're thrilled to see an investment that would help connect kids to critical services from birth to 5. So the earlier, the better. And we know that the Department of Children and Youth saw an additional 1,100 children served last year by this programming. So there is definitely a need to continue expanding these services. We have an action alert out now. I'll put that in the chat as well as the child tax credit resources that I mentioned. But if you go to our website and go to the Act Now button, you are welcome to just put in your address and your name, and it will send a note to your Ohio House representative that you support the investments being made for children and families. We'd love for you to do that. We'll be posting it and blasting it now through our Advocacy Day on March 12th. And I'd also love to invite you, we do a weekly stakeholder roundup at 9:30 a.m. every Thursday morning. I give a really quick budget overview about where the bill stands, where there are opportunities to testify, and whether any of these programs that support young children are at risk, and would love to invite all are welcome all the time. So thanks so much for tuning in today and listening about these programs for young kiddos. We really appreciate the support. And on March 12th, we have an advocacy day that's sold out, but there's virtual engagement opportunities. Thanks, Sarah.
Thank you so much, Brittany. We love good news. So thanks for sharing all of that with us. Let's transition now to talk about housing and send it over to Gina Wilt with Ohio to tell us what's going on in your world.
Great, thanks. Hopefully you can hear me okay. And thank you, AOF and Sarah, for this opportunity. And the co-panelist, this is a great lineup. I agree, Brittany. Although I feel inadequate following Brittany Boulton. Great presentation. I'll move through these first slides pretty quickly since most of you are familiar with Ohio, but we'll still try and ground us with some background and basics as we get into the budget discussion. So at the Coalition of Homelessness and Housing in Ohio, we do believe that we can end homelessness. And we're a coalition of organizations and people who are trying to do our best to be a positive force in the community. Sometimes a disruptive force, but a positive force, and trying to fuel advocacy efforts all across the state around all housing needs. So truly committed to housing justice and that constant movement towards making sure everyone has a safe, stable, dignified place to call home. So the second slide is just our gap study that we do every year with our national partner. You can see here over 440,000 households in Ohio spend over half their income on rent. That's 1 in 4 renters. We have a shortage of 267,000 plus units for our extremely low income renters. So that's just the shortage for extremely low income renters. If you look at the whole state, obviously that number goes up close to 1 million as far as shortage. But just for extremely low income renters, we are short over 267,000 units. And all of this information here that you're looking at does lead to kind of the discussion around the state of homelessness in Ohio. Over the last 5 years, we have seen an increase in homelessness. If you go back to even like 2012, we've had about a 30% increase. However, Ohio is doing better than the national average. For instance, just last year, the national increase was around 18%, while Ohio only had, I say only, we had a 3% increase. So not that we're celebrating that we're doing better than the national average, but I do think that it speaks to the thoughtful, hard work, the best practice hard work from our committed homeless service providers and housing providers. And so this slide here, you can see another study that we do with our national partner called the Out of Reach study. This shows the difference between kind of what we call the housing wage and what people are actually making. As we all know, rents have skyrocketed, housing costs have skyrocketed, but wages have only increased very slightly. Out of the 10 most common jobs, there really are only 2 that give families security to be able to truly afford a 2-bedroom home or apartment. And so this next slide does show some of those most common jobs in Ohio. And as you look at this slide, it might make you think, okay, how do we get the business community and the private sector involved? And CoHio has been, out on the front lines promoting the development of more affordable housing, promoting more home repair and preservation of existing homes and apartments. And we have been teaming up with other economic development partners. The affordable housing crisis is definitely going to take the public and private sector prioritizing development, and all of that needs to happen at the local, state, and federal level. And so one of our collaborative efforts is the Home Matters to Ohio campaign. And so I just want to share real quickly that in December, this multi-sector group did come together to discuss ways we could align and make progress in this space. And so this next slide shows some of the campaign recommendations and priorities, including improving upon the state low-income housing tax credit, protecting homeowners and neighborhoods from institutional investors, just the predatory institutional investors. If there's good ones, that's fine. We're only looking at the more predatory ones. Modernizing local codes and other innovative approaches. So, and then this slide here shows some of our steering partners for Home Matters to Ohio. If you're familiar with any of these groups, I encourage you to reach out to them and learn more. We would love to have additional organizations sign on to this platform. I think we're at like over 60 partners that have joined so far, from local governments and cities to Area Agency on Aging, AARP, Groundwork. Thank you for signing on, and others. So yeah, and I think the next slide just touches a little bit more on, so just we have 11 policy proposals. Some of them we would love to have positive momentum with them in the budget. So as we move into the budget discussion on this next slide, we have had some positive momentum. We did have last GA, the state low-income housing tax credit. That was a huge win. And that was also included in this budget just to continue it. It was not increased, but they did include it to continue that program moving forward. Same with Welcome Home Ohio and the single family tax credit language. Those were all from last GA. They got put back in this GA, so that's positive. And then the new item that was added is called the Ohio Housing Investment Opportunity Program, which the governor included, I think, to focus on housing development and services more in the rural areas of the state. So all good stuff. And then the next slide here, it wouldn't be a budget without discussing the Ohio Housing Trust Fund. This is definitely going to be a top priority over the next several weeks. Our other budget asks include the Ohio Department of Health youth homelessness line item, which we did see a cut from the last budget, which was because last budget we did have ARPA dollars. And so that did bolster that line item a little bit. But it is like a 30% cut this GA. So that will be a hard pill to swallow, considering that we have the same need. And maybe, so the needs continue. So we would love to maintain the level from last GA. We're also hoping that we can get a bump for the Healthy Beginnings at Home project. I don't have to tell this group that housing insecurity is a major factor in Ohio's high infant mortality rate, serving extremely low income pregnant women, who are either experiencing homelessness or at risk of homelessness. Definitely improves their birth and health outcomes for the mom and the baby, and saves a ton of money and actually saves lives. So very critical project that we would like to get a bump in that. And then the last kind of bullet here is just kind of a general all around helping our low income friends and neighbors who are struggling. There is a separate standalone bill, Senate Bill 83, that Michelle Reynolds and Herschel Craig are sponsoring to address eviction ceilings and some tenant representation for families facing eviction, but this would definitely require resources. So if there would be a budget opening here, we would wholeheartedly support this. Eviction diversion resources and you know, really helping tenants at that level, that those resources are just scarce. And so we would love to see the state fund some sort of access to legal representation or legal counsel, or more mediation for families, especially families with children. Our kids, our minors, our kids, our kiddos, they now account for about 29% of Ohioans who are experiencing homelessness in a single year. So prevention is obviously best. So if we can keep families from getting evicted, keep families stably housed, that would be the best option. The longer a family is homeless, the harder it is to get them stable and healthy and with kiddos who are ready to thrive. And, you know, whether it's in the health space, the education space, and all of the things that we talk about with Advocates for House Future. So the next slide just is the Housing Trust Fund. I know this is small and you can't see it. I do have, this is actually two-sided one pager. Would love if you are interested, and I can get that to you. But even with the state low-income housing tax credit, even with the governor's new 100 million for housing development in the rural areas, the Ohio Housing Trust Fund is still the state's most significant resource, primary resource for housing and homeless services, because of all of the money it leverages. So it usually is around the 60 to 65 million mark each year, but it leverages so much more. So it is still the primary source of state funding for all of local homelessness. So the 300 plus shelters all across the state, all of the affordable housing accessibility programs, so home repair, whether it's the Area Agency on Aging, Center for Independent Living, local government, most likely that's tied to the Ohio Housing Trust Fund. And then of course, affordable housing development, preservation projects. So that's all, so that could be Habitat for Humanity, a NeighborWorks developer, all of that is, you know, they depend on the Ohio Housing Trust Fund. And so the Ohio Housing Trust Fund fee revenues, they fluctuate with the housing market. Right now, there's no GRF. Since 2003, there has been no GRF with the Ohio Housing Trust Fund. That is funded by county recorder fees. That's just the way it was set up. And so it is, of course, when it's tied to recorder fees, tied to the market. And so the fees have fluctuated. And so recently the collections into the Ohio Housing Trust Fund have plummeted due to home price inflation, interest rates. People are not refinancing. There's not a ton of home sales happening right now. And so the same time Housing Trust Fund has plummeted, we have seen the increase in need for more affordable housing. So we're going to be asking the Finance Committee to create a backstop mechanism that dedicates some general revenue. So for the first time since 2003, we're asking for general revenue fund to only in the down years, only when the trust fund is really down, that they would kind of plug that hole and increase that, you know, the appropriation that can go out to help all of our housing service providers and homeless service providers. So I think the next slide. So those are our budget ask. And I just kind of wanted to close out with a few slides that talk about what, you know, we did a poll with another group that we work with, Opportunity Starts at Home, and all across the board, doesn't matter affiliation, all across the board, up and down, right and left. People believe that housing policies need to be worked on at the state level. So you can see the statistics here, 84%, 89%, 84%. That believe that we need to make strong investments in this space. And then the next slide, I think, shows, yeah, so, and also strong majority, and again, both sides of the aisle, support policies that protect renters from excessive rent increases, unfair evictions, harassment and discrimination by landlords. And then the next slide, I think, talks about, yeah, 8 in 10 voters in Ohio believe that government should play a role in ensuring affordable housing. So there's a lot more information about this poll. If you're interested, I'm happy to share that with you as well. If I can find the link, if I'm good, I'll put it in the chat. And then also this next slide, we do have lots of other resources. If you are interested in budget stuff or just information about housing affordability, let us know, or the criminalization of homelessness right now in some of the local areas around the state. We do have some information and toolkits, so please reach out. And the last slide, I think, is just, this is our team. And, Marcus is the one who creates all those great one-pagers and informational sheets. So credit there to him, and would love to be available for any questions, but I'll turn it back to you, Sarah.
Thank you so much, Gina. If anyone has any questions, please add them into the Q&A box. I do see a question here for you, Gina, asking, do other states have housing trust funds and how are they funded?
Yes. So yes, other states do have housing trust funds. Some are not funded. They have them, but they don't have any money in them. Some are funded very, very well. But most of the trust funds that exist in the 30 some states that have them, they're either funded through county recorder fees, like we are, or real estate sales tax. So those are kind of the two main ways trust funds throughout the nation are funded. And we had a constitutional amendment in a while back. I can't remember what year now, in the late 80s, early 90s, that went to the people. And it was a huge, overwhelming vote, yes, that the state has to be involved in ending homelessness, that the state has to be involved in promoting affordable housing options. And so after that constitutional amendment was passed, the state had to come up with a way to follow that constitutional amendment. And so it took a few years until 2003 when we have the trust fund that we have today. And that after lots of study committees, they came up with the county recorder fees as the method.
Thank you so much, Gina. And there was a question earlier in the Q&A about discussing more about the child wellness campuses. Just want to give Kate and Lysette an opportunity if there's anything else that you want to add here to the group about the childhood wellness campuses.
I hope that's okay that I answered that in the
Yes.
chat. I just didn't want to leave that person hanging. And so I don't necessarily have anything else to add other than I've been getting some questions from our members about who the kids would be that would be accepted through these wellness campuses. So as I mentioned in the chat, this model is after the work that Cleveland Christian Home is already doing. They're a member of ours. They're doing that work in conjunction with Cuyahoga PCSA. It would be, if we're following that model, just youth that are in the PCSA custody that would be eligible. So that's something that we're looking at and talking about because, as we all know, there are multi-system youth kids, kids on Ohio Rise that also struggle to find placements. Residential placements that need somewhere to go temporarily. So we're looking at that. But as of right now, we believe it would be limited to youth in PCSA custody, because that program is a joint partnership between the PCSA and then the private agency.
Yep, I'll just echo what Kate said. So we're just watching it. We hope to open it up to more population of kids, especially kids who are at risk of custody relinquishment, who aren't necessarily in PCSA custody yet. So yeah, I'm glad Kate answered it, because I feel like she has a a better handle on it
I
than I.
just visited our wellness campus in Cleveland, so it's fresh in my mind.
Oh, that's cool. We'll have to connect about it.
Definitely.
Thank you all so much. Thank you to everyone in attendance. Thank you to the panelists. You're all incredible, and really appreciate you carving out time in the busiest season every 2 years to share with us about your work. The webinar recording and the slides and all of the resources that were shared in the chat will be out to your inboxes this afternoon. And we're looking forward to staying in touch throughout the next 5 months of the budget process, and keeping you up to date. So we will talk to you soon. Thanks so much for being here. Bye, everybody.